Health professionals say with recent increases in cases of measles and mumps, it's important to vaccinate your children. But there are still parents who feel the vaccinations themselves could be dangerous. Fox 11's Kelly Schlicht has balanced coverage of this continuing debate.
Shayna Stoop says she views this booster shot for her daughter Ada as a minute of pain and a lifetime of protection.
Not vaccinating was never an option really for us. Why wouldn't you, I guess, is kind of our thought. If we can prevent her from having some sort of serious illness, I think it's a good idea.
Public health officials agree. The Northeast Wisconsin Immunization Coalition met this week to promote what it calls community immunity.
It's very important for adults as well as children to keep their immunizations up to date so that we all can be healthy from having healthy people surrounding us.
Diseases thought to be gone for good from the United States have returned, often brought back by people who have traveled overseas. The Centers for Disease Control says 189 cases of measles were reported nationwide in all of 2013. That's 3 times the norm, and the second most since 2000. Nearly 50 cases of measles have been confirmed so far this year just in California. That's the most since 2000. Closer to home and on a smaller scale, 3 cases of mumps were diagnosed this past week on UW-Madison's campus.
The younger generation is not as familiar with some of these diseases, and so sometimes if you're not as familiar, you're not as fearful of the disease yourself.
But some parents say it's their choice whether to immunize. Shari Reif says she vaccinated the first 4 of her 8 children before risk factors changed her mind. Reif feels early vaccination could lead to sudden infant death syndrome, or SIDS.
In Japan, when they did not vaccinate their children until they were age 2, they had a 0 SIDS rate. And the United States actually has the 5th highest SIDS rate out of all the developed nations. So to me, that was a big correlation.
The CDC says severe side effects like permanent brain damage or death occur in less than 1 out of 1 million doses. But Reif says the diseases being vaccinated against are also rare.
I think if your child's vaccinated and they work so well, you shouldn't have any worries that my child might be able to give your child anything.
As for Stoop, she feels her child's at a greater risk of catching measles or mumps than having an adverse reaction to this shot.
So whatever we can do to prevent our children from getting that kind of stuff, we're going to do that.
Kelly Schlicht, Fox 11 News.
We have links for immunization resources from the Center for Disease Control on our website, fox11online.com.